Hi, my name is Pooja. I'm an integrative nutritionist and I work with women who have hormonal issues. This is my first series of videos that I'm doing, and my first topic is PCOD. It is one of the most common problems that we see these days. It has taken an epidemic turn. A lot of girls are suffering from PCOD, and that is the reason this is the topic that I chose to be my first set of videos, because I feel that PCOD is something that needs to be addressed, and the medical protocol usually is not very helpful in the long run. So how do you understand what is PCOD and how do you correct it through natural means is what I will be covering in this series. I will be doing a series of videos on this, probably 10 to 12, where I will be explaining you what PCOD is, what are the symptoms, what are the tests you can get done to confirm if you have PCOD or not, and what are the main factors for PCOD. And then finally I'll be also giving you natural protocol to follow for 12 weeks, which can then uproot this problem from the root for you. I hope you find this series helpful and you get benefit out of following this protocol. Today is my first video on PCOD, so we will be starting from really basic stuff. Really, what is PCOD? What is even the full form of PCOD, which we keep hearing from everyone? Or this one has PCOD, or that one has PCOD. So what exactly is PCOD? And how do you identify it? What are the symptoms? So these are the basics that I will be covering. I will also, to start with, cover some basics about hormones. You know, what are the 4 hormones, critical hormones, that you need to know about, which are important for your cycle, and if those 4 hormones are out of balance, how then it affects you, and how PCOD then gets manifested. So what is PCOD? PCOD stands for Polycystic Ovarian Disorder, or it is also called as PCOS, which is Polycystic Ovarian Syndrome. They're pretty much the same thing. They interchangeably get used, so you don't have to confuse yourself with it. It's pretty much the same thing. Now, PCOD is a very recent phenomenon. So I was talking to one of the gynecologists, who's a very senior gynecologist, has been practicing since 1970s, and she told me that when she started practicing, when she was interning in the hospital, if they would find a case of PCOD, then all doctors would actually want to see and study it, because they had never seen something like this and they would want to know what exactly had gone wrong. But now she is still practicing, and she says that nowadays every second person who walks into her clinic has PCOD problems. So this is how a disease which was not even existing few years back has become so common these days. It's almost become an epidemic. So what has gone wrong in the 30 to 40 years that we've come to this stage where PCOD has become so common? So that is something we'll be covering in more detail in the later parts. But to start with, I will explain you what are the 4 hormones which actually govern our female menstrual cycle, which is because that is the basic from where everything then kind of stems out. So you have these 4 hormones every month which get released in a fine balance. There is a huge amount of balance and communication which is required between these 4 hormones for your menstrual cycle to work regularly and in a healthy way. So these hormones are luteinizing hormone, follicle stimulating hormone, estrogen and progesterone. Follicle stimulating hormone and luteinizing hormone get released from your pituitary gland, which is based just under your brain, and they then send the message to ovaries at the right time. Then ovaries, which are basically 2 ovaries which are present here just below your abdomen on the sides, they release then progesterone and estrogen. And all these 4 hormones, when they release in a correct balance, then you get a menstrual cycle in every 28 days. But when this communication breaks down for some or the other reason, they do not get the right message, then we start having hormonal issues. Now these hormonal issues can manifest in different ways. You can have period pain, or you can have extreme mood swings before periods, or it can be, if it is left untreated for very long, it can then turn into PCOD, endometriosis, ovarian cysts and things like that. So it can become complicated if not addressed in time. In PCOD, the ovaries, when you see them under an ultrasound, has lots of small cysts like structures. So they become like, the ovaries look like grape-like structure when you look at it under the ultrasound. So that is why they are called Polycystic Ovarian Syndrome. Now every girl, when they are born with certain amount of eggs in their body. Around 100,000 of them. Once they hit puberty, every month around 20 to 25 of them get released and they want to make an egg. So out of the 20-25 of these follicles, there'll be one egg that eventually will get released and which will be available for fertilization. If the fertilization does not happen with the sperm, then you get your period at the end of 28 days. So that is primarily how the cycle functions. So you have these follicles who are growing in your first 14 days of your period, and then out of them one matures to give you the egg, and the rest of the follicles, which are not of any use now, which produce luteinizing hormone and other important functions they do, but they do wash away from your system at the end of every month. So they are not required at the end of the month because you got your period, then they wash off of your systems. However, if you have PCOD, then these follicles, because of the wrong communication between these hormones, they sit and wait there because they get this message that there is no egg getting released. So they keep growing. And there is a term called follicular arrest which happens in them, where the follicles do not grow beyond a certain size and they keep waiting and waiting and waiting there so that the egg gets released. So the luteinizing hormone, which is responsible for pushing the egg out, keeps getting released from your system so that the follicles keep growing, and eventually its aim is to release the egg. However, the communication breaks down, so these follicles kind of sit around there and they do not get washed away from the system. And when they sit like in form of grapes. So they are not polycystic, they are polyfollicular sort of a syndrome that you have. So these grapes are basically grape-like structures are sitting on your ovaries, and when you look at it from ultrasound, then you know that you have PCOD. There are other symptoms that obviously because the PCOD problem does not give you symptoms straight away. It waits and waits and waits for a few months, and then when the communication still does not get maintained, then it starts showing you symptoms. So you will then start getting symptoms of PCOD, which then has to be then confirmed. If you go to a gynecologist, she's going to look at it from an ultrasound point of view and then going to confirm whether you have PCOD or not. But much before that, your body will tell you if you have PCOD or not. And how is it going to tell you? Because it needs to tell you that there is something wrong. What are these symptoms? So PCOD usually has typical symptoms like you will have irregular periods. So your periods will go missing. So either your cycle, which is 28 to 30 days, will become 35-40 day cycle, or it will become even you might just end up having no periods for 4 months, 5 months. So that is the first signal that there is some hormonal issue out there which is telling you that there is something wrong. The second symptom that you will have is male symptoms, because PCOD is primarily a high testosterone disease where there is more testosterone in your body. Women are supposed to have testosterone in their body. It is very important and a critical hormone, but in a very small quantity. It is present in high quantities in men, but in small quantities in women. But when this testosterone level goes up, it starts showing you male symptoms like facial hair, or you will start having deep voice, or you'll have male balding patterns. So you'll start losing hair from here, or you will have cystic acne. Now this is not an acne which is like simple pimples which come and go every 3-4 days. They are thick acne which are under the skin and they take very long to show their heads. So these are the kind of symptoms that you will see on your body which will make you think there is something wrong. So that is another way to figure out that there could be a PCOD problem. The third problem would be that which usually is seen in women who are looking to get pregnant. They want to get pregnant, and when they check, they are told by the doctors that there is no egg releasing from the body. From every month an egg gets released, but there's no egg getting released because you have PCOD problem, and follicular arrest is happening, and the follicles are not growing up to a size where an egg can be released from it. So that is another way to figure out that there could be a PCOD problem. So these are the 3-4 main ways through which you can figure out what PCOD is and how you actually identify if there is a problem like that. PCOD as a disorder can be very stressful for girls, especially teenagers, because this problem usually comes around when you are in your teenage or when you are in your 20s. you start having all these issues where, you know, and as a teenager you really want to, you know, it becomes a huge thing for you if your hair starts falling, or if you have a lot of acne on your face, and you're not able to lose the weight that you really want to lose, which you never had previously. So all these kind of things become really stressful and can really affect your confidence. So yes, for if you have acne, you can go to a dermatologist and they can give you ointments to clear up your acne, or you can get a laser treatment done to remove the facial hair that you have, or you can, you know, go to the gym and try to lose weight. But the problem is that it is not addressing the root cause. The root cause, why is it that you're having acne? Why is it that you're having facial hair? Is because of high testosterone levels. Why is it that you're having high testosterone? Is because of some other reason. There is some hormonal communication breakdown that is happening, because of which you're having this problem. So when PCOD needs to be addressed, it needs to be addressed from the root cause point of view. Okay, I have a problem of high testosterone. How do I fix it? Why is it that I have high testosterone problem? I need to fix that. So all these things have to be taken into consideration when you're looking at PCOD correction. This video was mainly to give you like a very brief outlook on what PCOD is and, you know, what it stands for and things like that. My next video, I'll be talking about how do you confirm if you have PCOD or not, because you need to get this confirmed through a gynecologist. So what are the tests you can get done? What is it that the gynecologist can do to confirm whether you have PCOD? And what is the medical protocol that gets followed is what I'm going to be covering in my next video. Till now, we have covered just the basics of what is PCOD and what exactly is going wrong in your body. So I hope till now, whatever information I've given you, you found that useful. And if you feel that this information is critical for you and you might get benefit from my next few videos, then please continue to watch my series, and I will look forward to your feedback. If you have any questions, please put them on the comment section. I'll be happy to address those, and I will see you in my next video. Thank you.